Approval for the agenda today. Judy, Reno, all in favor? It's carried. Thank you very much. On the agenda, any announcements of conflict of interest? Hear none. And if you do at any given time find yourself in conflict, please address that to the chair, and then we'll deal with it accordingly. All right, first order of business is, if we look back to our meeting, our last meeting was the board election, looking to build on our audit committee members. Just a question from our bylaws, and just to familiarize myself in that, like, is the treasurer automatic on the audit committee?
I don't think the treasurer is automatic on the, I just read the bylaws, and I don't remember seeing that, but we can verify while we're chatting here. I've got him on my desktop, so just give me a moment.
Nicole, I have them in front of me if you'd like me to read the composition.
Yep, great, thank you. You're faster than me.
It says, subject to meeting the qualification requirements, the board shall appoint 3 audit committee members with at least one of the appointees to be a board member. The chair of the audit committee shall be selected by the audit committee among those members who are board members, but it doesn't say specifically that the treasurer has to be on here that I can see.
Okay, because I know some other organizations, the treasurer is automatic, but anyway, I wasn't sure, so that's why I was asking. Okay. So right now I'm going to open up the floor for nominations for the position audit committee member. We have received 2 nominations here. The first one is from our treasurer, actually, Tracy Bailey. And the other nomination is from for Mr. Robert Mouch, I should say. Any further nominations? Second call. Any further nominations? Third and final call. All right, then I'll ask Tracy, do you stand?
I will stand, thank you.
Thank you. And Robert?
I don't believe Robert's on the meeting.
Robert is just coming on in a moment. I had to resend him the link. So he doesn't know he's been nominated yet.
Well, the railroad just came through town.
Perfect.
Perfect.
It happens when you're not on.
Well, let me know, Leanne, when he's coming on.
Yeah, not quite yet.
We're having some technical difficulties.
I believe he is. I'm going to try to call him.
Well,
Chair McNamara?
yes.
Well, while we're waiting, would now be an appropriate time just to talk about the additional member?
Yes, I was going to suggest that until he comes in. If not, I was going to call upon Dr. Nazatira to give us his COVID-19 report, but that'd be fine. Go ahead.
Sure. So just while we're talking about the audit committee, as our board bylaws identify 3 members, at least 1 member, from our board, we would like to recommend that we recruit a member to the audit committee externally. And many other agencies have an external member of the community that sits on their audit committee, for example, the school board. And so we would like to be able to advertise out for someone with some financial background to be part of the audit committee, and then those 2 standing audit committee members would be, part of that recruitment process for that member, interviewing the applicants to be a member of the audit committee. Maybe that is something that we could have a motion on, if that's appropriate, Chair, while we're waiting.
All right, so the recommendation is that you're saying the 3rd member is an independent,
Mm-hmm.
and, to be vetted through the audit committee and then presented to the board.
Correct.
Moved by Reno and supported by Gary Kashak. Any further discussions or comments? Hearing none, all in favor? Opposed? That's carried.
Great, thank you.
All right. Is he on yet? No. Okay, while we're waiting for Robert to come on board, then Dr. Nazatira, if you want to go ahead and give us an update on COVID-19.
So thank you, Board Chair, Mr. McNamara, Board Chair, members of the Board of Health. Thank you for allowing me to share a few comments and remarks today. I'm going to talk a little bit about the data, but the one thing that I always ask as a caveat is that the data always has to be taken in context, and no one data element fully captures the events or our current status. But taken together, I think that we would infer that the burden of COVID-19 today is less on the community than it was at the last board meeting. And that's manifest by the fact that we have a lower number of cases and a lower percentage of people that are having positive tests. But that being said, COVID-19 is still a significant burden to Windsor-Essex. There are currently 7 people in the ICU. There are 14 people in the hospital. There are 19 outbreaks, and 9 of those outbreaks are at schools. So there still remains a burden of COVID-19 within the health district. I think it's fair to infer at this point that the disproportionate burden of COVID-19 at this point is really related to young people and people in schools. There have been 300 cohorts, and that's our jargon at the Public Health Service, but there are 300 cohorts or 300 classes approximately of young people who have been excluded from school for some period of time because of exposures related to COVID-19. And I think that one of our key public health goals and key community goals is to keep schools open for instruction. And so I think we have to be vigilant at doing everything we can to keep schools open. On that note, about 2/3 of all young people are vaccinated, but 1/3 are not. So there's still an opportunity to get people vaccinated towards with COVID-19 vaccines. Where does Windsor-Essex sit in the burden of disease relative to other health districts? Well, on case counts, it's number 5, and on percentage positivity, it's number 2. So I would say that the burden of COVID-19 is better now than it was previously, but it's still disproportionately affecting the health district. I was at a meeting earlier today, and it was with the healthcare leaders in this part of the province. And, you know, I think, and I'd asked them, is this a fair characterization of the current situation at hospitals and healthcare institutions? And I think the consensus is that COVID-19 continues to burden hospitals, healthcare institutions, and physicians related to capacity and access. That's in both medical and surgical services, as well as in mental health services. That's also in the context, I think, of the fact that we're 18 months into the pandemic. And initially in the pandemic, we could have stretched people, and people are the key part of health. We could have stretched human resources. But I think we now have a group of healthcare workers who, for the most part, I think it'd be fair to characterize them as fatigued at this point in time. Board Chair McNamara, I'm pleased that you allowed me to talk about COVID, but I want to talk about something else as well today, and I hope that you'll indulge me. There are other items in the public health realm and the public health sphere that also warrant public attention. And the Public Health Service has been working on COVID-19 for the past 18 months. And perhaps that's reduced some of our public dialogue on other items. But I wanted to share with you how significant the opioid use and misuse, or opioid crisis, as some people characterize it, is. In Ontario in 2020, I'm just looking at the data here, 2,400 people, approximately 2,400 people died of opioid-related deaths. In that same period of time, there were about 550 people who died in car crashes. So there are 4 times as many people dying of opioid use and misuse than dying in car crashes. In Windsor-Essex, for this for the first 6 months of 2020, there were 400 overdose cases recognized. There were 20 people who died in the first 6 months. In 2020, the entire year, there were 80 deaths, approximately 80 deaths. So when we look at where we are with the opioid crisis, it's still a problem. And it may not have received as much public attention as it had before, but I think that's something that we have to really consider about putting our attention to. And on that note, I think that a couple of things that I hope that we would reiterate as in our messages. One is that about 1/5 of all people who die of an opioid overdose, looking at the most recent data, die with someone in attendance with them. And to that extent, that if we can get naloxone kits out to people, we might be able to save a life. And so people who, and I think that if you know someone who's using, or you think that there might be a situation and it might be worthwhile to have a kit, go get a kit, have it. I have one in my house. But to get a naloxone kit. The other thing is that we would ask those people currently using opioids not to use alone. A significant number of people die alone, and if you are going to use opioids, then at least try to do that with somebody else. There are a whole suite of things that we can recommend to try to address the opioid crisis. But I think that from my vantage point, clearly COVID is a priority, but I think at some point we also have to talk about the other public health priorities as well. So thank you so much for letting me speak today, and I'm happy to answer any questions.
Thank you very much, Dr. Nazatiri. Any questions or comments to our MOH? Yes, Judy.
So thank you for your report. can we note where the public can get naloxone kits and that they are free? Can we just mention again where people could get them?
So Nicole, if you could comment on that kindly.
Yeah, I could certainly start. I see Eric as well. So maybe I'll just say we do have our WeCosts, our Windsor-Essex opioid strategy website. And so all that information is on our website. And Eric, are you there? Do you want to speak to the naloxone kits and where they're accessible?
Yeah, I'm just putting the URL in the chat box here. So on wecost.ca, there's a link direct from the homepage there. It indicates get naloxone. We have a number of community partners that are enrolled in our Ontario naloxone program distribution. And we act as the community hub through which naloxone kits go out to those community organizations. So those are all listed on our website. In addition, there's a link to the ministry webpage that indicates local pharmacies that distribute naloxone. So that is probably the bulk of our naloxone does go out through our pharmacies, which makes sense because obviously people are filling their prescription through those sources, and so naloxone kits are available there as well. So those are located very prominently on that wecost.ca webpage that I put in the chat.
And if I could follow up, they are distributed without cost, and and that's a very important message to get out. Is they're free, and they're distributed without cost, and they're distributed without judgment.
Yeah.
So if you want one, you don't have to give any reason why you want to get one. You can get one.
And can I just follow up with a subsequent question? Thank you, that's great. Is that linked to the WeCost on the WeChew website? So if people were looking for it on the WeChew website, where would they find that? Thank you.
They would find that if through the chair, they would find that through the substance use content on our website.
Thank you.
Any further questions or comments? All right, a motion to receive Dr. Nezatiri's report. Judy and Ed, all in favor? Opposed, if any? That is carried. Thank you, Dr. Nezatiri, for the report. All right, we're going to go back to item 4, members of the board election. I believe Robert is online, and there were, if you remember, Robert, in the last meeting, there was a request to populate the audit committee, and looking at two members from the board and one outside. So we've dealt with the outside motion, and you have been nominated to take part on the audit committee, and with Tracy Bailey, our treasurer, and Tracy has accepted the nomination, and I'm asking yourself if you're willing to sit on the nomination committee, or not nomination committee, but on the audit committee. You've been duly nominated.
Yes, I've been duly nominated. Well, thank you, and I would like to thank the nominor, I think. Yes, I'm happy to do it. However, I should say that my accounting background is not entirely complex. I have more of a business background with these types of matters. So I'm glad to do it, but if you have someone with accounting that is better suited, I'm just disclosing that I do not have that background.
Yeah, well, at this stage here, I mean, you're obviously you're working with the auditors themselves, and
yeah,
and I can tell you that you don't need to be a CPA to be a member of the audit committee.
Fair enough. Then I'll do it. Happy to do it.
And that's why we're looking at an outside interest as well,
yeah,
to help us as well.
Yeah.
Okay.
Okay, so there were no further nominations at the time, and so both Tracy and Robert are now successfully elected to the audit committee. And with that, congratulations to both, and thank you for coming forward. And Leanne, through Nicole, will schedule your meeting, where both Tracy and Robert, you'll go through the applications and for the outside lay member to sit with you on the audit committee, and then your selection will be brought forward to the board.
Okay.
Okay. So, so at this stage here, if I could have a motion to accept both Robert and Tracy to sit on the audit committee. Larry and Reno. All in favor? Opposed? That's carried. Thank you very much. We've dealt with 5.1, and so we'll move on to the approval of minutes of the regular board meeting of September the 16th. Can I have a motion on those, Judy and Joe? On those minutes, is there any errors or omissions? Hearing none, all in favor? Opposed, if any? That is carried. Any business arising from the report? I believe, Lori, I think you want to maybe address the Q2 report to the ministry.
So Lori was called away unexpectedly, so she won't be able to join us. So just a note that it was just, she was going to provide a verbal update, but just a note that we, did submit our Q2 report, and, there's nothing extraordinary to share.
Okay, no, that's fine. Is she not reporting or offered her regrets for the rest of the meeting, or will she be coming back? She
won't be able to join the rest of the meeting.
Okay, yeah. Then we'll defer that.
Yeah, thank you.
All right, 8.0, we have information reports, consent 8.11, 8.12, and 8.13. Those are the infection prevention and control hub, the COVID-19 surveillance, epidemiology, and the communications recap. So could I have a motion to receive the consent agenda? Gary and Ed. Now on those, is there anything that our directors would like to highlight in their reports?
I'll just note the one 8.11, the infection prevention and control hub. So this previously, this is funding that goes through Ontario Health through the ministry to our hospitals. So this has been a great collaboration again with Windsor Regional Hospital, whereby there'll be, we have agreement that we'll take over this work, which really is very much in line with the work of public health for congregate settings, long-term care, and under the purview of our environmental health department. So we're excited about the collaboration and appreciate that partnership, and just wanted to acknowledge it. Excellent.
Thank you. If there's no further highlights from the reports, then a motion has been duly moved and supported. All in favor? Opposed, if any? That's carried. Thank you. Resolutions and recommendation reports. There's none to deal with at this meeting, so we'll move on to 9.0, new business, and I'll call upon our CEO, quarterly compliance, Nicole.
Yep. So you can find that on page 20. And there's, nothing material to report at this time as per the items in the quarterly report. Happy to answer questions if there are any.
Any questions on to Nicole on the report? If there's none, then if I could have a motion then to receive the report. Reno and Judy. All in favor? Opposed? That's carried. 9.2, fall immunization plan.
Christy. So
I would say the flu shot.
So I'll start, and then Christy's going to fill in the ministry. And you probably, as board members, heard us talk about it, but the ministry has requested a very large plan from all health units across the province, and it's a vaccination plan for the fall or into the new year, and it includes everything that we do, flu, continued COVID vaccination, as well as our immunization school. So the vaccinations that normally would fall under the Immunization of School Pupils Act. And I'll let Christy give a little bit more of an update, but just to say that I think, I feel like we're in really great shape in Windsor-Essex, and I think, again, that's thanks to the hard work of our staff, Christy's leadership, our health unit, but also the wonderful partnerships that we have with our healthcare partners, and in particular, our hospital and EMS partners. We would not have the capacity to achieve what we're able, or at least we think we'll be able to achieve locally, if it weren't for their hard work. So, again, just want to really acknowledge that, and then I'll let Christy provide, just some highlights for the board in regards to our plan.
Okay, so as Nicole mentioned, the plan is really immunizations in general. So there's 3 major sections for our immunization strategy. So it is for the fall, but knowing most of this work will continue into the winter, probably up through the spring. So the first section, of course, is our influenza vaccine, which is well underway. All of our high-risk facilities, that would include our hospitals and long-term care homes, have already received all of their vaccines. So that supply went out in September. We've also had all of our initial shipment of flu vaccine has gone out to all of our healthcare providers as well as our pharmacies. So that includes 241 healthcare providers and 124 pharmacies that are actively have received and are able to provide flu vaccine. First initial sets of doses, in particular high dose vaccine, goes and it's prioritized to 65 years of age and older. So individuals are encouraged to contact their healthcare providers or their pharmacies to receive that vaccine. It is available. We have no vaccine left in the building. We've placed our reorder, which is actually well on track, probably a little bit earlier this year. So it has gone out the door a bit quicker, which is great. From an expectation of demand perspective, we are from a supply, we are expecting to see a little bit more vaccine go out the door in this particular season. We're looking at about 115,200 doses of flu vaccine that we hope to have administered in our community, which is great. That's up from about 97,000 from last year. So hopefully we'll see additional doses go out. So that is ongoing. Our team works very closely with, in particular, our healthcare providers. They are one of the largest supply really sort of funnels that we have, in particular for the influenza vaccine, and they continue to be one of our #1 distributors in the community. So that is active and ongoing and will continue into the fall months. The larger sort of flu vaccine promotion started in November. That's pretty traditional, will align with the province. So recently there's been communication. So our community will expect to hear a lot more from us in relation to the flu vaccine in the next week or 2. The second major portion, of course, is our COVID vaccination strategy, which started on January 1st of this year, and I would suspect will be ongoing to January 1st of next year. So just in terms of third doses, and I think we've given some updates to the board, but just to confirm, so locally, our health unit has already completed the long-term care home, retirement home residents' third doses. All have been provided and implemented. There are, of course, from a timing perspective, there will still be some maintenance to do. So as an example, if individuals receive their second doses and hadn't waited that 5 months, we'll still be returning and supporting them for thirds. But generally speaking, the vast majority of those are complete. Every home has received vaccine and has been serviced. So that's, kudos to our immunization team who got that done with miraculous speed. So I can't speak enough about the staff, really, just in terms of managing all of this volume. It's very easy for us to sit and talk at a meeting, and I can review my notes here, but all of this work is getting done in the background by our staff. So this is really everyone's contributing to this, and in particular our frontline staff. So in terms of third doses as well, there continues to be an offering for in high risk or vulnerable populations. So and that includes people on specific medications as well as immunocompromised clients. All of that information about eligibility is available online. The demand has gone down. We've seen a lot of third dose bookings, and that we're pretty confident that that population that is eligible has been, attending and receiving their third doses. We are expecting additional information about expanded eligibility for third doses in the coming weeks or months from the province, but right now it is limited to that population at this particular time. So we are ready and bracing for more information about eligibility, and we do expect that to come in the short term. For first and second doses, first doses continue to be a priority from the Ministry of Health as well as us locally. So we continue to support the Mass Vaccination Center in partnership with Windsor Regional Hospital, as Nicole mentioned, has been one of our primary partners. We're also continuing a pretty successful mobile strategy, again, in collaboration with our community partners and in particular the CREST team, which is a compilation of our Erie Shores Hospital as well as our EMS. So we've done really clinics in pretty much anywhere that you can think of. We've done them in public parks, we've done them on buses, we've done them in community centers and businesses. We've done them in hallways and transit stations. So we have been out and about in the community for several months. So those will continue. As Dr. Necessary mentioned, we've still got a good portion of our population, about a third, have still not been immunized that we really need to reach. We continue to work with our school boards as well. One of the, of course, next big things will be our planning for an anticipated approval for vaccination for our 5 to 11 age group. So that's a big component of what we're thinking about into the fall. That strategy is essentially a full throttle strategy. So all of the channels we've been working up to open over the last 10 months, we will be using for this. So we know that from a vaccination perspective, providing options and opportunities is one of the #1 things that we can do to help facilitate individuals to decide to be vaccinated. We do anticipate, a really large part from our healthcare providers and our 5 to 11 rollout. So we're working to engage our healthcare providers and, hopefully see some increased uptake just in terms of their ability, comfort, to be able to offer that vaccine to, in particular, those 5 to 11 clients, knowing that that's a population that already we know pretty regularly accesses healthcare, in particular for that age group. So it is something we want to continue to pursue. Pharmacy will be an option as well. So continuing to support the many channels that are already open and really build on the strategy we've been working on for the entire year. So it's not necessarily, going to look very different. We know the actual strategies to immunize this population is different. It will require us to make, alterations to the clinic setup. So things that you don't necessarily think about in terms of, padding on the floors in case someone faints, even the height of the chairs, the height of the desks, the size of needles, all of these things will need to change. So our staff working with Windsor Regional will adapt both the mass vaccination site as well as any mobile strategies that we do pursue, and working with partners to find new opportunities for new mobile sites or pop-ups to support, in particular, this age group based on, what we're hearing in our local community. The last portion, of course, as Nicole mentioned, is really our school-aged immunization. This is something that, due to the pandemic, of course, we had to change our strategy pretty drastically. Given school closures, it's very difficult to immunize in school. So certainly we have a number of outstanding vaccinations for, in particular, it would be our grade 7s from last year who are now in grade 8, and of course our new eligible grade 7 students. So I'm happy to say that our health unit will be back in schools at the beginning of November. We'll be offering in-school immunization clinics to, it'll be a double cohort this year, so it'll be quite a large task for the current grade 7s that are newly eligible, as well as the grade 8 students from last year. We did have quite a bit of uptake from our healthcare providers locally to provide these vaccinations during, in particular, the school closures, and of course, from a resource perspective during the pandemic. But there's still quite a bit of work to be done. So we will, our plan right now is to get into the schools in November and do our first round. We will have to go back again in the spring for our second round, and it will be a double cohort at that time as well. We will be focusing on our high-risk schools in Windsor and Essex County, which means we'll also be offering catch-up clinics in January and February for any schools that are not receiving a direct clinic in-house. We also continue to actually offer in-house clinic appointments at the health unit in both our Windsor and Leamington locations, and those will remain available for individuals who don't have access to a healthcare provider and can't receive this vaccine elsewhere. So those will all continue over the next little while. So that's sort of the major plan in a nutshell. It's quite a bit. Certainly our staff have a lot. There's a lot of different arms going on at the same time. But that's sort of, we, as Nicole said, from a capacity perspective, we feel like our community is well poised, in particular for the next steps of the COVID vaccination rollout, whether it be first doses for 5 to 11 and then, upcoming third doses based on ministry direction as it unfolds. So.
I don't know if you took a breath or two. That was
no time.
That was amazing. I mean, and you can see how busy we are, and there's no question. I'm looking forward to getting my flu shot as soon as possible. Just a question on the usually what is the anticipated trend this year? It seems even from the province, kind of an urgency. Get your flu shots and you have the additional ones. Usually we get our cues, I guess, what happens in the Southern Hemisphere when they're coming out of their winter and now it's transmitting here. Do we know what type of flu season that they actually had in the Southern Hemisphere? Was it good? Was it bad or average?
So
Go ahead, Christy.
No, I was going to say, I'll defer to Dr. Nesathari in terms of that. I know from a demand perspective, there is an anticipation of increased demand for flu vaccine this year. We see that reflected in our supply, and the ministry has indicated, we will be doing, some extra promotion for the influenza vaccine this year, really encouraging folks to get it. Probably the one point I omitted to mention was really around recent guidance that we've received around co-administration of COVID vaccine with other vaccines. And so that does make it a little easier for us to really encourage folks to get both COVID vaccination as well as influenza, and that can be done at the same time. So I think that's one of the benefits that we'll see as a result of that policy update. But certainly I'll let Dr. Nesathari speak to trends or any sort of anticipated outcomes.
Okay, thank you.
You're on mute.
Yeah, there is a process to select the vaccine or to choose the right strains or what you anticipate the right strains to be. I think worldwide you've seen influenza outbreaks or influenza cases drop because of the masking and the other public health measures. I wasn't prepared for your question today on that one thing. So why don't I research it a little bit more and report back at the next Board of Health meeting?
That'd be fine, because I guess we're just getting into the transition now, but extremely impressed at the delivery of the vaccine. Kudos, Chrissy, your team, and everybody at the health unit involved in that, and certainly all of our partners. This is very impressive, and the sooner you get it out into the community, the sooner you can get it in people's arms. So I think that's certainly worth noting. So congratulations, job well done. Judy and Ed.
Did you say my name?
Yes, I did.
Yes, okay, thank you.
Hang on, Judy was just ahead of you, Ed.
It's very quick question, really. I know, Judy, you put your hand up. Very quick question, really. Out of all these vaccines we get from the ministry, do we end up throwing some of them out because they expired, or we have a use for them?
Christy?
So certainly, Ed, as a part of our vaccine management, we never want to throw away, doses of vaccine. So there are expiry dates. We work and plan around that. There are, though, limitations once vials are open. So certainly, depending on the demand for a day at a clinic, there are times, of course, when there are leftover doses that unfortunately can't be used. And that happens, of course, more frequently the further that we get into the pandemic, as we're opening vials and hoping, because they are multi-dose vials, which makes it really challenging. Not all vaccines are, but currently the 2 COVID vaccines that we do have are multi-dose vials, and so they do have to be allocated. There's been some updates to our ability to transport by single syringes and single doses, which has made it a little bit easier, but certainly, zero wastage is always our goal. And so, I'm pretty happy to report that it would be a rare occasion where we'd have to report wastage to the ministry.
I think the second part of my question, can we use those vaccine as a booster shot or something have to be different?
Yeah, sorry, so no, once our vaccine is expired, it's no longer permitted for use under our product monographs and medical directives at this time.
Okay, thanks.
Judy, and then Joe.
Thank you. And again, congrats, Christy, to the planning and outreach for your team in the flu and the COVID. It's just amazing. And I really am focused always on how do we get it to those most vulnerable. And speaking of that, just wondering, there was no cost for the COVID vaccine. For the flu vaccine, is there a cost? Is it free if you go to your doctor or if you go to the pharmacist, that type of thing, just so people are aware, because we want that not to be something people are assuming and stops them from going for their flu shot.
Yeah, the influenza vaccine is free for residents of Ontario.
Great.
Joe?
Yeah, thank you, Chair. A quick question, Christy. In terms of the other sector, the ones that are shut-ins, the mobility issues that can't get out, I know after the long-term care, after the second dose vaccine was given, the LHIN was responsible to go to the homes, and I think there's about 300 residents in that regard, and they plan it out. Are they on the list? Have they been given the booster vaccine to start going into the homes yet? Do you know?
Yeah, thanks for the question, Joe. So the health unit worked with the LHIN pretty early on to make sure that all of those individuals that were homebound did receive their first and second doses in March and April. And actually our NP staff here at the health unit teamed up in many cases to deliver that. Individuals that are homebound, though, would have to still follow the eligibility criteria. So some may be eligible based on their current medical conditions if they're, as an example, taking a specific medication or they're immunocompromised. So in general, as a grouping, they are not currently eligible, but some individuals as a part of that, depending on their medical condition, may be. And so, if there was a particular case, we actually still continue to do homebound vaccination maintenance. So as those come up, and we'll continue to support those boosters as they become eligible.
Okay, thank you.
All right, Gary Kashak.
Thanks very much, Chair. And Christy, appreciate your report there. Interesting that you had said that it's okay for people to get the flu shot and the COVID shot at the same time. Is that correct?
Yep, that's correct. There was updated guidance that was provided by NACI, which is really the National Advisory Committee on Immunization, that has indicated that it is safe to have a COVID vaccine co-administered with other vaccines. And so this does sort of open up opportunities for folks that, as an example, if they were still needing their COVID vaccine and were able to attend a pharmacy, they would be able to potentially receive both at the same time.
Yeah, that's real good information. And will we be marketing that in our communications piece here moving forward? Because I think that can certainly bump up our vaccination numbers on the COVID side for sure, and certainly on the flu shot side also.
Yes, and certainly that's something we're working with our partners on as well. So not only our pharmacies, but healthcare providers, as well as other mobile opportunities. So as an example, moving into the fall, this is new guidance that still, everyone's really, reading and understanding. But I do anticipate into the fall, our COVID, as an example, mobile clinics will be able to offer flu vaccine as well as COVID vaccine at the same time.
Wow.
In some of our, in particular in our high priority neighborhoods.
That's fantastic. A dual cohort shot at the same time. Thanks very much, Christy. And that's all I have, Chair.
Thank you, Gary. Ed, you still have another question? I see your hand still up.
Is it a new hand or old hand?
The left one or the right one? Okay. I don't believe he has a question there. So any further questions to Christy? Then if I could have oh, go ahead.
Mayor Snively has his hand up.
Yes, thank you. Through the chair, Christy. The numbers of COVID vaccines, okay. Do we have numbers of the younger people going in and getting vaccinated, like the youth? Are those numbers on the rise?
So our wonderful epidemiology team keeps a great up-to-date dashboard on the health unit's website that actually breaks down our population and in terms of their COVID vaccination statistics. We do have that broken down. Sorry, go ahead, Nicole.
Yeah, I was just going to say it is going up, but it's not drastically going up. It's inching up for youth. But Christy's right. That information can be found holistically on the website. So the total of youth as well. It's broken down, our team has broken it down by FSA, forward sortation, so your postal code, the first 3 numbers of postal code. So you can look by area as well and age to see, where we're at. And then weekly, our EPI team puts out a report, shows the change over time, but we're not seeing sweeping increases.
But
Low.
it is.
Low, it is increasing, it's climbing,
It
yeah.
And one further question on our pop-up clinics. What's the response on those, the last ones we had? What's the numbers like? Are they on the rise? Are people coming in?
Unfortunately, Larry, they've been declining pretty steadily over the last month or so. Our mobile and pop-up clinics have definitely, we used to see numbers of upwards of 200 to 300 at a single day site. And unfortunately, they've gone down quite a bit, sometimes in the single digits, unfortunately. So we'll continue to work with our partners and find some creative locations and solutions. But, most definitely, and I will say as a community, we benefit greatly from having our mass vaccination site. It is walk-in availability as well. So anyone can walk in at any time without an appointment. Our pharmacies as well pick up quite a bit of walk-in traffic. And our pharmacies that are offering COVID vaccine are also very highly situated in our high priority communities and our postal codes, so which is another real benefit as well.
Okay, thank you for the info.
Okay, any other further questions or comments?
No.
Okay, on the report, just a move to receive the report. Larry and Gary, all in favor? Opposed? That is carried. Thank you. All right, we'll move on to the Project Governance Committee, a review of membership. That's on page 22. Nicole, if you want to bring that report forward.
Yeah, so we just included, obviously, the terms of reference, as we get this committee and this work moving along again, the terms of reference will clearly need to be updated, but we wanted to include them for as they stood for the board. And whether or not, so currently there's quite a few members that are part of this. It's a large group that is part of the Project Governance Committee. As you can see, it requires 2 city appointees, which currently are Reno and Fabio, 2 county appointees, which are currently Gary and Joe Bicchetti, and then Judy as our provincial appointee. And then obviously there's the vacancy, which by default, Robert would be Robert to have the second provincial appointee, and that would be the committee. We were going to propose an external person for this committee as well. However, it's quite large, and so I think that may be a discussion as per, for the committee once they convene. And Leanne, I believe, has put out an invite for a meeting to get this started again. So there's not necessarily a nomination required, but just thought that you may want to review the size of the committee. And if there's any discussion on that at all.
Mm-hmm. Pleasure of the board. Well, Nicole, I think that's, I guess as they say, marching orders, and just keep it, get Leanne and then to schedule a meeting.
Yep.
Okay. Alpha Fall Symposium. Nicole.
So I believe Leanne sent information out for the Alpha Fall Symposium. Obviously, there will be a number of speakers. It is a really great opportunity for members of the board to engage, and hear, what's happening in public health now, and certainly what's on the horizon. So we would encourage, encourage board members who are interested in attending certainly to attend. It's a one day, so it's actually less of a commitment, and without traveling, it's virtual, so it makes it even easier to attend. And so we would just, you can certainly review the agenda. It's available now. And, in the past, I think we had limited the number, but, we believe it's a really important time in public health and don't necessarily have that limitation. So if you are interested in attending, and we encourage you to do so, you could let Leanne know, and we'll make those arrangements. And
well, I'll make it easy. I will participate. I couldn't believe it. I looked at November 19th, and I had a clear schedule. So
great. And we won't put everyone else on the spot, but yeah, if you just want to let Leanne know, and we'll take care of everything else. Thank you.
All right, so everybody, obviously, if Leanne sent out an email blast to all of you, and if there's some interest there, I will leave times of essence right now, but certainly avail yourself if you want to certainly partake. All right, we will move on to correspondence. I believe we have. Let me look back here.
So there.
10.1 to 10.4.
We are, Chair McNamara,
Yep.
We are recommending, they're all for receipt with the exception of 10.2. We would recommend to write our own letter of support, similar to, and support the what was put forth by HKPR. And in that letter is really just acknowledging the continued support of COVID-related expenses for the health unit into the year of 2022.
And I would add as well as that 10.2, and that's been circulated quite a bit through the municipal sector as well, and it's all been supported, obviously, and so that is an ongoing, because we're not out of the woods yet, and there's certainly 2022 still going to be a bit of a challenge for all of us, for sure. So then a motion to support those recommendations. Reno and Ed, all in favor? Opposed? Carried. All right, well, at this, on the public side, we don't have any further business, and so we need to I believe go into the committee of the whole.